Some animals are more comfortable lying laterally for blood collection or IV placement. If an animal is injured or sick, this may be a more accessible vein as well. For the most part, the lateral saphenous vein is used in the dog, and the medial saphenous vein is used in the cat. For both species, the handler's job is to control the head and the front of the animal while extending the back leg and applying pressure to the vein to hold it off for the technician drawing blood or placing a catheter. Pressure is applied to the caudal aspect of the leg in dogs and the medial aspect of the leg in cats. Once the procedure is completed, the handler applies gentle pressure to prevent bleeding or hematoma formation. For feline medial saphenous venipuncture, the holder will use the hand holding the caudal aspect of the animal's body to grasp the forelimb that faces the ceiling. Then, the hand will bend that limb in toward the animal's abdomen while simultaneously exerting downward pressure on the medial thigh with the lateral aspect of the hand. The downward pressure occludes the vein. Once the blood has been collected, the venipuncturist places the thumb over the needle insertion site and applies pressure for 30 seconds to allow a blood clot to form. For both lateral and medial saphenous venipuncture, the venipuncturist will need a syringe with needle, alcohol, and blood tubes. The size of syringe and needle and blood tube types depend on the samples needed. While the holder is occluding the vein, the venipuncturist should palpate and/or visualize the vein. Then, alcohol is squirted lightly over the area, or the area is swabbed with alcohol-soaked gauze or cotton. The venipuncturist will hold the paw with the non-dominant hand, aligning the thumb next to the vein. With the dominant hand, the needle is inserted, bevel up, at approximately a 20-degree angle into the vein. The needle should be inserted completely in the vein if possible to provide additional stability. There will be a flash of blood in the hub of the syringe, and the venipuncturist can slowly and steadily draw back on the syringe plunger to collect the blood sample. Because of the smaller gauge of the needle, upon completion, the needle is removed and samples are transferred to blood tubes.